Happy Thursday, everybody. Welcome to Paperboy. It is Nicholas. This week, our topic is on medical transitioning and what precautions to take. So, with medical transitioning, I think that the first thing that you need to do is really sit down with yourself and think about what steps are appropriate for you to take. Not everybody wants to get on hormones. Not everybody wants top surgery. So you really not everybody wants therapy. So you need to sit down and really think about what steps are appropriate for you personally, and also what is legally required in the state that you live, or the country, or wherever you live. For me, when I started transitioning, I did so in Seattle, Washington. So it was really, really easy for me to do it there, because it is a informed consent state, which means that you don't need to have a letter from a therapist or anything like that. You pretty much just need to make the decision that you want to go on hormones, and you can go into an informed consent clinic and get that done. And so that's how I did it. I had a testosterone prescription right after my first appointment. But sometimes that is not an appropriate step for everybody. Some people really, really benefit from therapy, and should look into taking that step first. But sometimes therapy isn't necessarily appropriate for everybody. But then again, there are some states and countries where that is a requirement before you start taking hormones. So, after you decide what steps are appropriate for you, you need to kind of look into what the legal requirements are in the area that you live. And then after that, start Googling clinics in the area that you live. Sometimes you might have to drive a couple hours, especially if you live in a small town. I know that Planned Parenthood is a good place that does informed consent in a lot of areas. Not all Planned Parenthoods do it, but oftentimes the ones in the major cities do. I actually utilize Planned Parenthood for my hormone services. I go to the one in Denver, Colorado. So if you do decide to go the informed consent route, Planned Parenthood is a good option to look into. It's also a really, really good idea to do a lot of research on the different types of hormones that are available to you, and the different types of administration methods. Like there's injectable, intramuscular, subcutaneous injectable testosterone. There is, I think there's pellets. There is a testosterone gel. So you really, really need to do the research on this, though, because a lot of doctors, unless you go to a doctor that has trans-specific health care, a lot of doctors do not know a lot about treating transgender patients, especially if you live in a small town or a rural area. So it's going to be up to you to kind of really, really do your research and know your stuff. Also research all of the doctors in that area and see if there's anybody that has experience with transgender healthcare. It's really, really important, because a lot of doctors just really don't have the experience, and they kind of get baffled and confused sometimes and don't know what to do. So it's important to both do your research and try to find a trans-friendly healthcare provider. And then if you choose to go for top surgery, that this is another step. Really, really, really make sure that you look at all of the doctors that you're considering, and look at the patients that they have worked on that have similar body types to you. Because the patients that have similar body types to you, that's how your results are likely to look. So find a doctor that has operated on patients that have your body type, and you really like the look of their results. Now I know it can be um, really tempting to just jump into top surgery and just go to somebody that's the closest to you and the cheapest. But just remember that you're going to live with these results for the rest of your life. It's an expensive procedure, so just do your research and try to be patient and wait for the doctor that you really want, because you're gonna have this chest for the rest of your life. So if you can, try not to just jump into the first and the cheapest doctor that's near you, because you know you want something that you're gonna be happy with. Okay, that is enough of my rambling for today. I hope everybody has a fantastic Thursday. Don't forget to like, subscribe, and share, and I will see you next week.